Hi, Erin Miller, Vice President of Health Initiatives with the Colorado Children's Campaign, here to talk to you today about some new and really concerning data that recently came out from the Census Bureau. So this data is from the American Community Survey. We've been looking at it over the last couple of weeks, and a new report with some additional findings is coming out from Georgetown University tomorrow, October 9th. What this new data shows is that 73,000 Colorado kids lacked health insurance coverage in 2019. So going into the COVID-19 pandemic, 73,000 Colorado kids lacked access to healthcare and financial protection that is provided by health insurance coverage. This number is up almost 30% since 2016 when Trump took office. We saw the largest single year loss in coverage from 2018 to 2019 when we saw 10,000 more Colorado kids lacking health insurance coverage. And again, these kids went into the crisis caused by COVID-19 without coverage. This is before any of the job losses or any of the economic fallout from the pandemic. So what's driving these numbers? I think that what's happened is that the federal government and the Trump administration has finally created headwinds that are just too hard for our state policymakers and officials to overcome. They've created administrative barriers that make it more difficult to get kids enrolled in coverage and to keep them enrolled. They've reduced outreach and enrollment funding through the Affordable Care Act. And they've been spreading anti-immigrant and racist messages that make our immigrant families scared to enroll in coverage for which they are fully eligible. Further, the uncontrolled spread of COVID-19 had a dramatic impact on our state budget. And in this last budget cycle, a number of programs had to be cut that could make it even harder to get these kids and families enrolled in coverage again. Specifically, the Healthy Communities program had a nearly 75% cut in this last budget cycle. And that's a program that's designed to help kids and pregnant people fill out their enrollment paperwork and get covered by Medicaid and CHIP. We've seen coverage losses across racial and ethnic groups. They have been concentrated in our lowest income families and particularly pronounced in public programs like Medicaid and CHIP. And this really, it's a tragic story because it's a real reversal of successful trends that we'd seen in the state over the years. For more than a decade, we'd seen the number of kids in Colorado who lacked health insurance coverage decline dramatically. Then it stalled, and over the last several years, these numbers have been increasing, which is what this latest data shows us. And the impacts of this loss of coverage are going to be felt for decades. We know that kids with health insurance coverage are less likely to drop out of high school, more likely to finish college, and have higher incomes as adults. We know that health insurance coverage reduces infant, maternal, and child mortality rates, that it improves mental health status. And so we have to do everything we can to get these kids back into the coverage that they're eligible for. So we hope that you'll join us. We hope that you'll vote for kids in this coming election. Ballots are coming out next week. Look at our website for our ballot guide, but a couple of propositions that are key for this issue is to remember to vote no on Proposition 116 and 117. Those are propositions that would have dramatic hits to our state budget and make it even harder to get kids enrolled in these critical health programs. And follow our website for more information. We'll be continuing to look at this data and look for policy solutions here at the state level. And remember to vote for kids this election. Thanks so much.